Assalamu alaikum. I'm Dr. Salma Abbas. I'm an infectious diseases consultant at Shaukat Khanum Hospital. We are recording this message to create awareness on antimicrobial resistance, also referred to as AMR. This is AMR Awareness Week, and the theme for this year is Educate, Advocate, and Act Now. Antibiotics are drugs that are used to treat infection, and when used correctly can be life-saving. However, over the past few decades, there has been injudicious and inappropriate use of antibiotics. This has rendered previously effective antibiotics ineffective, and this is what we now call or refer to as antimicrobial resistance. With worsening antimicrobial resistance trends and without effective antibiotics, we are unable to treat infections that would have otherwise been treatable in patients. This leads to significant loss of lives. And as an estimate, I can tell you that by the year 2050, if this trajectory continues, there will be about 8 million deaths annually per year secondary to antimicrobial resistance. If we look at different patient populations, the impact of antimicrobial resistance is manifold higher in patients who are immunocompromised, such as cancer patients that we treat in our hospital. The mortality may be twice as high compared to the general population. Another key consideration with regards to antimicrobial resistance is antimicrobial side effect profile. Once we run into problems with antimicrobial resistance, we lose the ability to use first-line or traditionally recommended antibiotics. The second-line antibiotics that we have to use for resistant infections are associated with a much worse side effect profile and lead to adverse patient outcomes. Human health-related issues cannot be viewed in isolation, and issues such as antimicrobial resistance not only affect human health, but also have impact on wildlife, the environment, and the ecosystem as a whole. We all need to escalate our efforts in our capacities to ensure that we adequately combat antimicrobial resistance